Listen to this. The birth rate in the U.S. is dropping and actually hit an all-time low in 2024. Fewer than 1.6 children were born per woman last year. And in the early 1960s, the total fertility rate was around 3.5. But a CDC review of birth certificates released earlier this year found a 1% increase in live births in 2024. That's about 33,000 more than the year prior. Here to explain is Dr. Joanne Stone. She's a maternal fetal medicine specialist and a professor and chair at the Icahn School of Medicine at Mount Sinai. Dr. Stone, thank you so much for joining us. So my first question is, explain what this means, that the fertility rate is dropping, but the number of births increased.
So the general fertility rate means the number of births given to women who are aged 15 to 44 per 1,000 women. So while the number of births actually increased, the number of births per woman decreased. So there's just a larger pool. And it's really interesting when you break it down into age-specific numbers. So women aged 15 to 34 had a decline in number of births. Women aged 35 to 39 were stable, and women who are 40 to over had an increase in births. So it's really those women in their 40s that are driving that small increase in births.
And doctor, do we know why we're seeing a decline in the fertility rate?
Well, fertility rate, I think, is an indicator of public health. So I think we have to ask the question, why is that? And I think things like access to reproductive care, health economics, the cost of living, housing, and paid parental leave are key factors to that decrease in birth rates.
When we do see a dip in the fertility rate like this, is that something we should be concerned about? Why does that matter?
I think it matters because there's less people coming into the workplace. I mean, years from now, we're going to have less workers, less people in the classroom. So I think that it does have a large impact on the overall population.
Now, the Trump administration has actually been trying to encourage Americans to have more children. We're seeing benefits, expanded access to IVF, baby bonuses to families, things like that. Could those potentially be effective?
I think there's a lot of controversy about that. What is the actual impact going to be? So that executive bill is asking for recommendations. I'm not sure it's going to impact our low-income women and have access to those women who seek those kind of care. And we know the maternity deserts across rural America. So I think it remains to be seen what that impact will be.
And when we talk about the fertility rate, I mean, is it economical? Is it cultural? Is it a lot of factors that are influencing this?
I think it's a lot of factors, and I think the fact that we're seeing women in their 40s show that women are delaying childbearing for both personal and professional reasons. Medical advances are really important. You know, advances in reproductive technology are helping women who are older to have children. But I think, you know, overall, that's what's driving that change.
All right, Dr. Joanne Stone, thank you so much for joining us. We appreciate it.
Thank you.